Good morning. This is Dr. Suresh Kumar from Apollo Hospital Swanagaram. I am representing the quality team of Apollo Hospital Swanagaram. Today we are discussing the new approach what we have followed in Swanagaram Apollo Hospitals there. Hospital acquired infections, every one of you know, previously it was known as nosocomial infections. This is one of the biggest challenge every hospital in the world is facing there. Why it is happening? It has got so many reasons. The patient related factors. Second thing, during hospital, a lot of issues is going around to develop this nosocomial infections or hospital acquired infections. Then even after the procedure, after the discharge, certain things can cause these infections. What do you mean by this nosocomial or hospital acquired infections? Commonly happening catheter associated urinary tract infections. When patients are admitted for some surgery or because of ICU, some Foley catheter put that develops some infections post-procedure. This is called catheter associated UTI. Similarly, ventilated patients develop infections called ventilator associated pneumonia. Following surgery, developing infections is called surgical site infections. These are all major problems we are facing many of the hospitals, not only in India, across the world. So what the hospitals are doing it? Hospitals are taking corrective actions. Once the event happened, hospital do root cause analysis. What is happening there, why it happened, how to prevent the next event. Usually whatever happened to the patients, we are not doing anything there. We are taking correct preventive actions for the next patients. We are taking preventive actions for the next patients, but ignoring the patient who already suffered it. But in Apollo Hospitals, Swanagaram, we have slightly modified the approach. Instead of doing a corrective actions, prevention comes first here. That's called PACA. Prevention action first, followed by if our prevention efforts are failed, we are going to correct little later. This is approach we are following from last 2-3 months there. What do you mean by prevention actions? Prevention is first. So when a patient comes to our hospital, we are looking for the patient-related factors. Patient-related factors means, for example, obesity, or the person is a smoker. Before surgery, we try to reduce the smoking. We ask the person to stop smoking it there. Preparing the skin, ask him to get showers. That's called pre-op showers. These are all the factors we routinely do for all patients. But in addition, when a patient stay, we expect it going to be a long one, or the person's line, as I told earlier, Foley catheter or ventilated. So we are taking utmost precautions. Do good hand hygiene, monitor the patients who is going to expected to stay a little longer, who has got some risk factors for developing infections. We focus that individuals. My infection control nurse will go there and daily check whether all safety